Okay, we are live
Oh,
and please share if you can, as always.
What?
Please share if you can, as always. Share.
Oh,
Turn on your screens, let the magic unfold. Listening and healing
when
as
getting married?
stories are told. Come on, come on, this is your time. No topics too tough, just heed the call. From mental health woes to justice we seek. Together we rise for the strong and the meek. A safe space for all, let's lift every voice. In a circle podcast where hearts unite, sharing our truths, bringing hope to the light. Community strong, we're never alone. Together as one, we've created a home. With laughter and love, we break down the walls. No topics too tough, just heed the call. From mental health woes to justice we seek. Together we rise for the strong and the meek. A safe space for all, let's lift every voice. So join the conversation, let's set the tone. In a circle podcast where love is well known.
Okay. Welcome, everyone. Welcome to our guests out there, all those tuning in today to listen to us. Another interesting topic today. And as always, our great panelists are here for us to dive into issues that affect or that is affecting our community. Today's topic is health equity in minority communities. Health equity in minority communities. It is something, that impact all of us as minorities. So today we just want to dive into it and discuss it. And our panelists will be giving some data, some statistics. And if you have question or concern, as always, please reach out. Okay, you can comment and you can call our number. So we'll give the number out there. It's 817 600 So before we dive into the topic, I will let the panelists, you know who they are, always here. I'll let them introduce themselves quick. So I'm Abe Kamara. Today I'm your host, Miss B. Okay, Mel.
I'm Melvin Lionel Zia, one of your panelists
check it
here.
out.
Thank you for joining us. We're about to dive into a complex topic, and we kind of
Is it
anticipate you
climate
guys to
stop?
participate so we can discuss something
And how
that
is it
is
burnt?
impacting our community as minority individuals in America. So participate, guys. Join and take part and contribute to it. Thank you.
Okay, Titus.
Good evening, everyone. I'm Titus. I'm glad again to be here to engage into this conversation with you all. Thanks for always being there with us. Thanks for joining and participating in whatever way you've been doing. We appreciate you. And come on, let's do this. Let's enjoy this one.
Okay, thank you. Miss B.
Good evening, everyone. It's your girl, Miss B. I'm excited about the topic tonight. Let's go.
Okay, so tonight is gonna it's three to is I'm the host, I'm gonna be news just so it's 2-1. So so it's 2-1. All the ladies, the panelists left Miss B on her own tonight. But again, the topic here is health equity in minority communities. So before I get to my panelists, we just want to put a definition of what health equity is. And Miss B, if you can help us, just kind of go through it for the sake of our audience, just folks know, right, is that what it is I'm going to be talking about today, just to provide some, high level data first, and then before we get into it.
Well, when it comes to women, we suffer when it comes to Black women, of course. We struggle the most with, we have higher rates of many of these illnesses. like hypertension, breast cancer at a younger age than other women, diabetes, stroke, and lupus. We suffer the most because we tend to get ignored, right? And so we have groups out there that have been highly focusing on that, and we'll talk more about those groups. Some like Black Women's Health Study, who has a lot of different data when it comes to Black women and their health in the state of in this country. I will say people of color, unfortunately, has a lot of inequities, across the board when it comes to health. Where you live really determines your life expectancy, right? When you look at the statistics of urban core, where predominantly Black communities are, BIPOC communities, that's Asian or Latinos, live, their life expectancy is less compared to their white counterparts, right? And so, what are the things that are causing that is are the likelihood that we're around, manufacturing or warehouse type businesses. We're near highways, high pollution things that can cause our life expectancy. We're not in walkable neighborhoods. Our walkability is decreased. We're not around parks and recreational things that
Okay.
should be free, right? And so
Okay.
those are all of the things that continue to impact us as people of color here living in America,
Okay.
and has social determinants that impact our health.
Okay. Thank you, Mel. Obviously, today, we have put some definitions out there, and Ms. B went into some of the things, that affect our communities, in terms of health equity. What is your take on this topic, and how do you think we can address some of these things as you provide your take?
Thank you, guys. Thank you, Miss B. Thank you, AB, and thank you, everybody. This is a complex topic looking at the health issue or health equity in minority in America. It's an important topic, but it's very complex. I think it encompasses disparities in access and also kind of look into the health care and the equity of care. And then you look at the health outcome. And here's, I'll kind of name a few things that I will dive into here as we go. So one of it is disparity in access. The minority communities tend to often face barriers in accessing health, such as the lack of insurance, transportation challenges, and then limited availability of services. Then you have the socio-economical factors. Many groups tend to experience higher rate of poverty. Unemployment kind of contribute to that as well. And then you have lower education. So like she mentioned, a lot of us work in factories. We work at these low income jobs. So affording those uh, health insurances that will kind of take care of the expenses of treatment is challenging for them. Then the last piece I'll talk about is the cultural competency. So healthcare providers may lack understanding basically of cultural beliefs. So those things tend to contribute to why we tend to have healthcare issues among minority in America.
So just real quick, you said it's a complex topic. Why is it complex? Is it because we black people, minorities don't like to talk about healthcare or health? We like to maybe avoid those topics. Is that why you think it's complex
It's
or
I mean, it's complex because it is a complex issue because you're looking at health. Health overall is a big topic. And then, like I went into it as I was talking, cultural and belief. Some people might not want to dive deep into it to kind of understand the importance of it, to navigate the system and kind of have that, means of having healthcare that will help them, being well. So it is complicated. I spoke of their job wise, right?
okay?
Low income job that we kind of get. That's what makes it complex. We'll dive into stats as we go. There are a few stats I have here I'll kind of dive into as we kind of talk about it. But overall, healthcare topic are very complex topics. So
Okay.
um, I believe it's complex.
Taris, what's your take on health equity in minority communities? The topic on our discussion tonight.
So I think this is a great topic. Are you hearing me, guys?
Yeah, we can hear you.
I think it's a great topic, and my counterparts have stated various areas where blacks, Ms. B is focusing mostly on black women tonight, and I'm with you. So just relax. It's no two versus one tonight. And then Melvin, gives some different areas like cultural competence, access to healthcare. But one other area that I would like to add is the language disparity. So for some of us immigrants who did not come here with a background of speaking English at home, I had learned English. Like the Hispanics, they face a lot of challenges as far as receiving those care because providers are having a challenge with understanding what they're saying. So I mean, it brings some a level of difficulty in giving them that care because of that barrier. And then health literacy as well, just folks being aware of their health status. And
Okay.
again, we can go more into the stats
Hmm.
here, but folks being aware of their health status, especially in the US, their proficient health literacy and stuff like that. Insurance coverage, Melvin already spoke on that.
Okay.
So yeah, this is a serious topic. I have personally seen, right? I've been a direct bystander
Sure.
of watching a black woman who was very close to me, and I lost my cool, right?
Okay.
Received nonchalant care within the healthcare space. And I
Sure.
know it was because of her color. So we're here to provide the stats. We're also here
Okay.
to talk on personal experiences. So let's go. Let's have this
Two
discussion.
things there though. Two things that you raised there. First, you said the language barrier, right? I think, these days there are a lot of interpreters out there. I mean, there's so many and a lot of interpreters out there. Do you still think in today's America there's still that language barrier? There's still that. I mean, folks are still facing, I mean, language barrier in terms of accessing healthcare. When there's so
Well,
many interpreting
so
services,
this
services.
will not be about what I think, but there are statistics. For example, the National Healthcare Quality and
Mm-hmm.
Disparity reported in 2019 that 22%, about 22% of Hispanic adults
Mm-hmm.
reported the challenge that they the in the care that they received based on providers not understanding them. So whether there were interpreters there at those health facilities or not, their health care that they received were very poor. And in fact, some providers, as the report states, some providers even kind of mocked,
Okay.
those patients who were Hispanics. So yeah, we do have interpreters all over the place, but that can also be used as a disadvantage to discriminate against minorities.
So you think it is intentional?
I'll say partially, according to the report,
Okay.
yes, it has proven that those instances have been intentional.
Okay. The other thing I would like to put before I go to Miss B and then to Mel, you say you personally had a personal experience. Do you think it happened because of? You say it happened because of a race. Why you think that? Why you think?
Absolutely,
Yeah. Why you think?
absolutely.
Why you just want? Why you just playing the race card right there? Why you think? She wasn't given the proper care because of a race.
Well, because being in, and I'm not the kind of
And what
person that
was it?
likes.
What was it that made you to draw that conclusion? I guess.
Let me come to it.
Yeah.
Since I'm not the kind of person that like to jump straight to conclusion,
Mm-hmm.
right?
Mm-hmm.
I had a conversation with not just this provider
Mm-hmm.
who was a nurse who was supposed to start
Yeah.
the process of taking care of that black woman at that time
Mm-hmm.
before the doctor or the physicians come in. But I
Yeah.
also had conversation with other staff who were in the hospital.
Yeah.
She had a bad rep, and I was informed besides my observation,
Yeah.
right?
Yeah.
Besides what I felt, I
Yeah.
try to get facts. I
Mm-hmm.
was also informed that the management of that healthcare facility had received multiple complaints on this person, and they had even come to a certain conclusion that this person was kind of discriminatory against minorities.
Oh,
This is
the specific
this
provider,
this
like the
this
nurse or
is
the
real.
doctor.
This is real life. For and this is just besides the observation with non-minority patients getting swift care and being
Mm-hmm.
attended to,
Mm-hmm.
in the swiftest possible time,
Yeah.
right?
Mm-hmm.
And if I mean, you know me personally, I'm usually I like to think of myself as being cool and collective, but I literally lost my cool. So yeah, it was
Okay.
there. It was
Okay.
up
Okay.
there.
Okay. Miss B, I mean, you mentioned some of the factors that, it's like, let's assume, I mean, there are a lot of, I'll go right there, right? A lot of blacks, minorities in Broken Park. Are you saying their life expectancy is lower than maybe they're compared to someone in Maple Grove or in Plymouth? Miss B, can you hear me?
I think she's frozen.
Okay. Mel?
Yeah.
I will kind of throw a similar question to you there, right? Is do you think, Miss B alluded to, hey, maybe like life expectancy is like life expectancy when it comes to health equity depends like where you live. So my question to you is, someone living in Maple Grove versus someone, there are a lot of minorities in Broken Park, right? A lot of good factories, factories out there. Do you think someone living in Broken Park has a lower life expectancy versus this, like a white person living in Maple Grove or Plymouth?
I don't have data to prove that, but here's what I would say, right? Now, election is ongoing. These local governments, government officials that are elected make those decisions that impact the people that live in those constituency. How
Hmm.
many of us you see representing us within those areas that we live in? So area of Maple Grove will have, someone that will represent his or her people and pass policy that will impact people's life when it comes to health issues. So yes, if you are you have these people making this policy that are affecting your life positively as it relates to the topic we're talking about, you tend to get more healthcare benefit from your constituent, and also you benefit from it. Unlike somewhere like Brooklyn Park, there's no representation to kind of speak of these things, and people voices are not being heard. So from that aspect, I can look at it from that aspect. There's a stats that I kind of pulled from the Center for Disease Control, which is the
Hmm.
CDC, that
Hmm.
reported that Black Africans are 1.5 times more likely to die from heart attack compared to their counterpart, white folks. And then when it comes to the Latino community, that number has doubled. So these things
Is
have
it
to.
is it let me just hold you there, right? Is it because of because is it because of is it because of inequity, or is it because of the life choices that we make as black folks or like Hispanic folks? It's like,
It's because of
why
it's
should you blame it on, like, maybe the healthcare is not being equitable enough to black people versus
it's
the life
it's
choices that we are making?
it could be life choices you make as an individual. But
Mhm.
if you have insurance, wherein equity is being distributed evenly, inequity distribution of health can lead to those things as well. So partially, it falls on life choices we make, and it also falls on you having you being insured, having adequate health care to take care of you. If you're getting treatment as you need to, you're getting these prescriptions that help you to prolong your life. You wouldn't encounter what someone who doesn't have those things you have will encounter. So yes, what you're saying, those things contribute to them. But my question now to you, Abby, do you think black folks make poor decisions when it comes to healthcare? Is that what you're trying to say here tonight? Only black folks? So
No, I'm saying no. Here's the thing. Here's the thing. It is. I mean, one of the thing, right? Especially like Liberians or Africans or minorities, sometimes most of us do not even like, since the passage of Obamacare, the Affordable Care Act, there's like, preventive care is free, but there are a lot of minority folks do not, uh, do that. Sometimes they wait until, like list like the breast cancer Miss B talked about earlier. Sometimes some folks wait when it's late, before there's like they go for for minor checkup, and then that comes up. So it's like, where is the accountability piece? I guess Miss B, I'll come back to you on that. Right? Where's the accountability piece? Instead of just blaming it on, because like health equity. Where is the accountability piece in the minority community? Why is it, that we just want to blame it either on racism
For
or there's or economic factors? Okay, Tadas, I'll
Oh,
go to you.
she's struggling.
Yeah, she's struggling tonight. Tadas, I'll go to you.
So we did talk about a little bit. We talked about the healthcare literacy, right? So if that's not, we might have some numbers when it comes to health illiteracy, but then let's go back to the representation that Melvin talked about. If we are represented fully and adequately represented within our district, as Ms. B referenced earlier, that areas that most minorities live in will have less representation, less health care facilities, access to health care. Who are we going to be obtaining this health education from? In most cases, in areas, in environment and communities where there are multiple access to healthcare, folks have the liberty of having primary doctors, right? And the fact that there are multiple access, it's easy to access health facilities. You get you get more, you have a more chance of becoming educated about your health compared to areas where there is no health facility. So you gotta think about it holistically. Yes, I'm all for the accountability, but there is something with the system
Okay.
and how disproportionately the minority are receiving poor and unfair health, health treatment in the healthcare system.
Okay. Okay. Miss, first of all, let's say why I get what Miss B settled in, guys. This is an important topic. Health equity in the minority community. So if you're listening out there, you want to contribute, you can comment in our chat, or you can call us on 817-600-1525. Why is it, that we black folks or minorities, Hispanics, are facing disparities when it comes to healthcare? It's an important topic. So 817-600-1525. Miss B, I'll ask you the question I asked Mel earlier. Is like someone living in Broken Park, right? Is a lot of minorities there versus someone living in Maple Grove or Plymouth. Why is it their life expectancy from what you mentioned earlier might be lower than versus someone living in a white person living um in Maple Grove or Plymouth?
So I want to say that because of the work that I do, I work for a nonprofit organization. We are an
Mhm.
issue-based organization.
Mhm.
And one of our social justice programs that we address is health equities, right?
Yeah.
And, you know, I oftentimes we thieves exist because we created thieves, basically, right? You condition somebody to do something, to become something, and then the very thing you condition them become, you punish them for becoming that thing. And so when it comes to Black people and people of color, the inequities exist because the systems created those inequities for them. And they're living and they're trying to be resilient within these inequities, but yet we continue to blame them for their existence in these inequities and trying to still be resilient and thrive in the inequities.
How did the system do that? Can you expand on
Example, when you think historically, Black people are not, and culturally, we're not unhealthy people. We're very hardworking. We did a lot of work. We are transit people, first of all. We're walking. We're most likely to be walking or taking some kind of transit. We don't have the generational wealth to say 9 times out of 10, the Black home doesn't even have a vehicle. So those things right there will condition us to be more healthy and have more preventative care measurements traditionally and culturally, right? Just even think back to the African community, right? Well, the thing is, if I live in the most poor air quality area, the most highly polluted area. All of these things are going to cause me to have worse health outcomes, things that are not even of my control. And then you add the fact that I cannot afford the health care, so I cannot afford to get the checkup. And then you increase the statistics and the percentage of us that are going to be unhealthy. For example, look at where your highways are built. You
I mean,
had a,
highways are built everywhere.
but just look where they're built the most. Maple Grove, certain parts of Maple Grove, you're not going to see a major highway going through a residential community. Like right now, Freeway 252 is looking to turn into a highway. Okay. Historically, the Rondo community had 94 West go strictly through the middle of that community. Rondo community was a wealthy Black community here in the state of Minnesota in St. Paul, where you had Black doctors, lawyers, hospitals, Black-owned grocery stores, right? And they decided they needed to grow the highways and build a major highway, and they put it right through a predominantly Black, wealthy community. So therefore, you're going to have now all these health disparities, right? And sometimes money does not change the way we'll be treated. In 2022, Serena Williams wrote a whole article for a magazine. I have my statistics up here, but my computer is giving me trouble. Wealthy Serena Williams, well-renowned all over the world tennis player, very healthy woman, goes to give birth, and she almost died giving birth because she was the discrimination that was happening to her, not respecting her, not listening to her as she was trying to advocate for herself while trying to give birth. So
Why would that aspect of it, right? It's like Serena wouldn't have all the resources to your point, she could access healthcare. Why is it that boom, it is because of a race? Why is that conclusion drawn right there?
and that's the thing. What else could she conclude it to? I have all the resources. I'm probably in the best medical facility, right? I'm having the best physicians attend to me.
It could have
So
happened
what
to a
else?
white person though. It could
So
have happened to a white person.
so what other thing could I use to describe the way I was being treated? And
It,
so that's what we look at, all of these nuances. And if everything else is in play and it's working accordingly, the only thing left for me to say is the discrimination is happening because of my race.
okay.
It
Thank you.
must be happening because of my race. And
Okay.
I would say I myself here are very I've had a personal incident to me at
Sure.
the clinic.
Hmm.
They tend to think that Black women have a more high tolerance for pain. I went in there 3 hours. I was in pain. I wasn't laying on the floor crying or, wailing or anything like that. Finally, I get to the emergency room behind the back there where they have you admitted to a room. I get admitted to a room and still no doctor. After 45 minutes of sitting in that room, you know what I had to do? Open my door, literally yell at the nurse.
That happens to
To
everyone.
me, I
Why
had to yell
that
at the
happens to
nurse.
everyone? That
And
happens to everyone.
no,
Everyone complains about the emergency room when you go to hospital. Sometimes it takes a while for your doctors to see you. Why does it have to come down to the issue of
that's
race?
why the study and research is done, because we don't want to say we're crying wolf. And there will be a lot of data that will show the health disparities between Black people and white people.
Okay.
If race is not an issue and it doesn't
Mhm.
matter, why does this country keep so much data based on race?
Well, it
Everything in America is calculated and researched based upon race.
Let me support
because sometimes you have to
this.
know about specific demographics, to be able to make better decisions. But I don't think, right? I don't think that everything should boil down to race. I don't think so. You know what I mean? Like in the
Well,
same
we're
case,
not the one.
I
We're
don't think
not
a conclusion
giving
should
these
have been
numbers.
drawn there. Okay, go ahead. Go ahead, Titus.
We're not the one giving these numbers. The
Thank you.
statistics that have been done from different population, different sample sets all across the nation. Okay, CDC reported in 2021. If you
Mhm.
say that this happens to everyone, the experience that Ms. B just talked about,
Yeah.
why is it that there are more maternal mortality rate for the Black woman compared to the white woman? In 2021 alone, according to the CDC, the maternal mortality rate for Black women was approximately 69.9 deaths per 100,000 live Earths compared to 26.6 for white women. So you
That's
can't
a huge difference. Huge
you can't
number difference.
this is a
Is
huge
it? Is it?
disparity.
Is it?
You
Okay,
cannot
I get it.
argue
I
these
get it.
numbers.
There's that disparity. I get it. I get it. There's that disparity. But again, is it because I mean, black people or maybe black women, most of them do not seek the care that they need, even
That
with
that
all
is
the
not,
resources,
there's
even with all the
there's
resources. As I said, since the ACA, okay, is like preventive care is available free of charge. How many black people take the opportunity to do that? Mel.
first of all, no,
Okay, okay, go ahead. Go ahead.
healthcare is not free. You
I'm
have
not
to
saying it's free.
qualify
I'm not saying
for
it's free.
whatever
It's
for whatever.
affordable. It is very the ACA made it very affordable. And
Maybe
preventive care is free.
Evie,
Aff-
Evie.
Affordability
Wait,
is
wait,
subject.
wait, 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 wait. Let Miss B finish your thought, then I'll come to you, Mel.
First of all,
Okay.
healthcare is not free in America.
I'm not saying it's free. I'm not saying it's
One,
free.
you said
Yeah.
free here a lot of times.
No,
So affordable.
preventive care.
First of all, America does not practice preventative care. We are always reacting. We are a reactive country, unfortunately.
Mm,
Harvard University did a study on immigrants versus Americans. Immigrants who come to America are healthier than the Americans as a whole in this country because we don't practice preventative care. We're always reacting to things. That's
okay.
just the reality.
Okay.
Those who are practicing preventative care, if you know you can't rely on a system and it's not there for you, you're going to practice preventative care. You will find more people of color are practicing preventative care. Not because that they really want to, because the system has forced them to do so.
So if
So
they
to
are
say we don't
practicing
want to take
prevent, right.
advantage of it, we talk about the type of jobs that we work. Who
Yeah.
controls that? We talk about the neighborhoods. You're ignoring the fact that the neighborhoods that we live in are highly polluted because when they wanted to open that warehouse, that manufacturing, that car factory, where did they bring it? Into the Black communities, right? When they want to have high pollutant jobs, they bring it into the urban core. That's where you'll find a lot of the high polluting jobs. And again, highways, we are more likely to live next to highways and freeways than our white counterparts. These are things that we do not control. If you want to hold us accountable, we do not control. Redlining. White people determine where Black people could buy homes, Amy. There's a thing that called
That
redlining.
was
That the real
that was
map
19 that was
it
19
still exists. Golden
that
Valley
was
still has it,
1775.
it
You
still
trying to
exists.
put up
No,
you trying to give
Golden
us
Valley is
1775?
92%.
How did I?
Golden Valley is 92% white-owned homes because they still have covenants. The thing they call covenants, where my house will not be sold to a Black person, still exists till this day, 2024. There's
Okay.
a whole organization working with these communities to change those covenants so that they're no longer written in their house deed. It's written in the deed. Go and Google. It's
Okay,
written
thank
in
you.
the deeds that you do
Okay,
not sell to a Black family. So all of
okay,
those things impact our health,
okay.
where we
Mel.
buy homes, where we can buy homes.
Okay, thank you. Mel.
Yeah, Evie. You keep saying race got nothing to do with it, but these
No,
stats
I'm
we are
not saying
giving.
you guys are exclusively blaming it
No,
on race.
no,
As I said, that we
no,
shouldn't
no,
do
no. It contributes to it.
it.
According to the Census Bureau in
Mm-hmm,
2020, right?
mm-hmm,
Approximately 10.5 Hispanic and 9.1 Black in America were uninsured. Now,
yeah.
why is that as compared to the white population at 5.5? Look at that number. It's huge. Now, why you think those things are happening? You mentioned
So if
insurance.
you're on, so
I
if you're
come,
on,
Eddie.
okay, okay.
Eddie, let me learn.
Go ahead, go
If
ahead.
you had said insurance is free or health insurance is free, it's
I
not
didn't say that.
free. When you apply for these things, they first of all look at your income. Now they want you to be making below $30,000 to be qualified for those things. Now, how can someone be living, paying rent as the cost of living increase, and you want to be living below $30,000 to be qualified for health insurance? Now, looking at that. How many people will sit down and be like, I'll just work for 12 months and I want to make $30,000 and just to be qualified for health insurance? So, as a result, people will not go for that. Right? So these are contributing factors. They're not just saying it because we want to say we are Black folks who want to defend it, but these are stats that are given by qualified bureau, renowned bureau. So we're not
Okay.
making these things up.
Oh, okay. One thing I'll point out to you though, you said that if you are working, in most cases, whether even a low income job or whatever, you know what I mean. I think companies provide health insurance.
No,
You're shaking
Not
your
all
head,
no.
Miss.
companies,
You're
AB.
shaking your head, Miss
Providing
B.
health insurance is not
AB.
free. Providing
Uh-huh.
health
Yes.
insurance is not free. You know how
I'm not
much
saying it's
it's
free. I'm not saying it's
two
free, and
hundred
that's what
and
the
fifty-four
ACA
dollars out of
going
a
to subsidize
$30,000
it.
income
I'm not
per
saying
pay
it's free.
period.
What?
$254 per pay period, Abraham, out of a $30,000 income.
The,
And
Who
tie
can
that's why
that.
afford
the
that?
ACA.
And so you
That's
know
why
what
the
people do?
ACA
They
subsidizes it for people
they
with lower
turn
income.
it down. You know the
Wow.
thing called working poor? We have more working poor people. You know, people think that
Mm.
poverty is poor people's thing. We have more working poor in this country. That's why they have an unemployment rate. That's why they have an unemployment rate, and they calculate that unemployment rate out of 337,000 people, 300 whatever million people in this country. If your
Mhm.
unemployment rate is 10%, that's only 300,000 people that's not working. That's only 300. Look at all the millions of people that are working in this country. And so in that working category, you have people who are working poor, meaning no matter how much they work, they just cannot afford all their basic needs. That's why we
That's
talk
what.
about campaigning for livable wages, Abraham. People don't
Okay.
want to pay livable wages. Cost of living goes up every year, and your wages don't go up according to cost of living. So who's going to pay for that in that deficit in my in
That's
my
a-
in my wages now that the cost of living has gone up? Who's covering that?
Okay. Okay. Titus.
So I think what we're basically saying generally here is
Hmm.
there are uncontrollable factors that minorities, and not
I
just
do.
black.
I do
I
disagree with
don't
that.
want you to just focus on blacks,
Hmm.
even though blacks might be taking most of the group here,
Yeah.
but minorities. And the stats continue to provide the numbers, the facts. If it's one thing to argue my opinion, it's
Hmm.
another to argue facts. They're facts.
Yeah.
They're proven, they're tested. So they're there. What else
The
do we
facts
need
are there, right? Okay, the
to
facts
think?
are there, but it contributed. What are contributing to those numbers that you are quoting? Is it you guys are saying that's because of the person race or the economic factor that's contributing to that? And that's what I'm saying is like, where is the accountability piece? Where is it that most minorities do not seek healthcare, even with the even when they have the resources? A lot of minorities have insurance; they don't go to hospital. As I said, the ACA made it mandated that preventative care once a year is free. How many
Okay,
people in the minority
let's
community take advantage of those things?
let's scope.
Hmm.
Let's narrow this thing a little bit.
Yeah,
Let's put what we're just talking about as far as you mentioned folks being uninsured at work, even though jobs
I said
offer.
insure. I said they are insure, and the ACS subsidizes that
You said
even with low
jobs
income.
offer insurance, right?
Hmm.
And the stats show that non-Hispanic versus Hispanic
Hmm.
are more uninsured, right? Than Hispanic, right? Like whites.
Maybe they are not taking advantage of the health insurance at their job.
There's no
Let's
study shows that, Abraham, that somebody is not taking advantage of
A
their health
study is
care.
not going to show.
about
No
it.
study is going to show that.
No, no, because
No
that's just
study is going to show that. If they offer you the option, no
That
study
means
is going to show that.
But Abraham, then why are you basing that as a stat? Why are you basing that as a
it's
rationale
part
for
of
the
No
conversation?
study is going to show
Because,
that. The
but that's
fact
what
I'm, the
Titus
fact
said.
I'm trying to state
You
to you here,
cannot
the fact
argue
I'm trying to
facts
state to you here,
and
most
data.
companies
You
offer
can't
health
argue facts and
insurance.
data. You can't argue facts and data. You want to argue opinions, and opinions with not backed by facts or data is not valid for the conversation. It
irrelevant.
has no validity. An opinion and assumption has no validity if you don't back it up with facts, data, and research.
Absolutely. Absolutely.
Okay. Well,
So
with that, guys, here's the thing.
uh,
Call us 817-600-1525, or you can comment in our comment box. You know what I mean? Contribute to the topic. The topic here today is health equity in the minorities in minority communities. Why is it black people, Hispanics, immigrants, have more health disparities, like compared to white folks? Miss B here is saying because of where we live, and the rest of the panel is basically, I said, because of where we live. We have a lot of factories in our communities. We have low wages. Most of us cannot afford health care at our jobs. And those are the reason why we face health disparities. So if you want to contribute to the topic tonight, 817 600-1525. With that being said, right, with all of these things that with all of these statistics you guys are quoting, what it is that we can we do as minorities to improve this statistic? What it is? I mean, are we always going to be blaming the other? I mean, it's like the Caucasian population. Are we always going to be blaming the system or other people? What it is that we need to do to improve these things? I mean, we have identified the problem. What can we do? I will start with Titus.
Provide more health literacy. You
Yes.
know, earlier when you talked about like folks, a lot of African American folks are not privy to information when it comes to, especially the women, right? When it comes to time for mammograms. I know this because, we've done research on it and we've talked about it in various settings. There are a lot of our um, African American or African women who would sometimes go for those checkups when it's already past the time, and they'll realize that they already have, a start of that cancer. And hopefully, sometimes it's early, but at times it's really late when they find that out. So I'll say health literacy, right? Just bringing out that information, organizing, mobilizing, providing information. Another thing that we need to take very seriously is the representation. This cannot be overemphasized. If we do not have representation in our various areas, districts, counties, who is going to provide these or talk for us about access to healthcare? Who is going to provide, who is going to change or drive something that is going to change these policies that if you experience something like discrimination because
Okay.
the implicit bias of white providers, and if you say something about it and expect that there will be repercussions, who is going to implement those repercussions in those hospitals? Who is going to drive those policies to say, look, this is a non-tolerable zone. We have zero
Okay.
tolerance. There has to be policies to drive those things. So,
Okay.
I'll just touch on those two points right now: the literacy and driving the policy, that representation. We really, while we're taking accountability, these
Okay.
are we must really impact.
Okay. Amel, whose job is it to bring to drive literacy to Tato's point? Whose job is it to bring literacy, right? To educate ourselves or to educate us about health literacy or all of these things you guys are talking about. Whose job is it? Is it yeah. That's basically my question. Whose job is it? That's my first question. Yeah.
I tell you Arlington Edelman story.
No,
I
no, no,
think
no. I will leave you at that for you.
it's
I will leave you at that for you.
it's everyone's job. However, people that are living in those communities that are being impacted, that have knowledge of these issues we are faced with,
Mhm.
to kind of help their fellow community dwellers to engage into community engagement by doing data collection and seeing how those things are impacting their specific group of people, and come up with solutions. So there are people amongst minority community that are informed. We have few of them that we know. Should we should try to disseminate information to help them be informed and make informed decisions. So one thing I mentioned is data collection, and then community engagement, then intersectionality, understanding how these things are impacting our race, like the minority community.
Okay, and then like to your point though, if all the data you guys have quoted here tonight, these are things that have been around. Why is it that we still lacking the literacy or the education? Why is it we still lacking those education in our communities? Why is it that the education doesn't exist in our community even up to this day in 2024? When
I
all of
think
these data you guys have been quoting have been around for a while.
I
It didn't
think
just
So I will say,
come out of the blue today.
so
Okay, go ahead,
okay.
Miss B.
So I will say that there has been changes, right?
Mhm.
Um,
And depending on where the hospital is, the clinic is, there's been advocacy for more people of color to work in those spaces. For the language translation. So oftentimes in the state of Minnesota, you will see they do translations beyond 20 different languages. So
Mm-hmm.
typical Somali, the typical thing you're going to find most places you go is Hmong, Somali, um, Latino or Spanish, English, those key because of the population here, right? You're going to find it in most hospitals, most places. You will find those translations available. I know there are more translation companies.
Mm-hmm.
Even right now, when you go to the hospital, right? Typically, a Liberian person goes to the hospital. Maybe they speak Kra or whatever dialect they speak. The hospital has
Okay. So Mel, I'll go back to you while we wait
Yeah,
for Miss.
yeah. So, so,
The one
so
thing.
to answer
No.
that question,
Yeah. Yeah. Go ahead. Go
to
ahead.
answer that
I
question,
want.
I think Tados touched you a little bit. Representation, right? We don't have representation in leadership here.
So
So
let me just hold you there, right? You guys keep talking about representation. Again, I'll come to it. Who jobs is it? I mean, we live in a representative democracy. We live in a democracy where like you should, like right now we have a Liberian that is running for the city council of what? Broken Park. Okay, we have minorities even there's at the presidential level. Kamala Harris, it's a minority. She's wanting to, to become president of the United States. Whose job is it, right, to provide a representation for us? Well, most of us, as I said, we don't vote. We say, oh, I'm not into politics. Are we going to blame the system for not getting all the representation that we are seeking or that we are that we are advocating for? Are we
that's
just
that's
going to
the
say, oh
that's
yeah,
the
give us
biggest that is the biggest problem we are faced with. All
Mhm,
right. We are not, a lot of us are not interested into things that will impact us positively. Whose job is it? It should be our job to promote our fellow compatriot, the people that look like us, to put
mhm.
them in the office. But right now we got early voting going on. How many black people you will see that will go vote? It's saddening. Now kind of take the time and be like, you know what, I'm going to vote. We did it today. At some point, there were just one or two black folks we saw when I went to the Plymouth Community Center. And the majority of people that were voting were these white older folks, and majority of them were white. So these are things that we need to address. And it boils down to community engagement, education, making them to understand how important it is to have these representative in government that will make decision, make policy that will impact us positively, and then we'll have health equity within the minority community. So that's the biggest picture, AB. We a lot of conversation need to be held amongst us, and just educating us the importance of having representation.
Okay, so Miss B, it's like that's my point right there. We are not taking account. We are not being accountable, right? We aren't taking accountability. We're not taking the responsibility to do things that will improve our what, our either our economic situation, our health situation, all those things. Because in this country, right? Right now, as I mentioned, before you came back on stage, Broken Park has a black Liberian immigrant running for city council. Okay, at the highest level in this country, a black female is running to become president. You have a lot of black folks there. Maybe she doesn't agree with my she doesn't align with my values, so I'm
Listen,
not going to vote for her. And then we expect that things is going to magically improve for us when we are not taking the responsibility to do things that will improve our lives. But then we keep blaming the system, we keep blaming racism.
can you guys hear me?
Yes, yes, we can hear you
Yes.
clearly.
I apologize for the internet.
That's
So
fine.
quick, when it comes to Kamala running for office, a lot of black men are the number one people who don't want to support her, unfortunately. So I'm going to put that right there.
Okay.
When it comes to people questioning her ability to lead, it's the black men, unfortunately, who are not supporting her. But we're going to get her through. She's going to persevere by the grace of God. She's going to win this. Because the last election showed a lot of black men voted Republican. It was Black women who voted heavily for Biden, and he thanked us day of his inauguration speech. If you go and listen to it, and so those are some of the things that we are dealing with, because oftentimes men, unfortunately, are in leadership, Black or white, are in leadership making decisions around the healthcare system. And if you want to talk about women being left out in general, and then Black women, that's a whole nother thing. So who's responsible? I say me. It starts with me, right? I do my best. I'm heavily involved. I'm involved in my community. I'm an advocate. I'm out there talking to people, having one-on-one conversations. I do it for work and I do it outside of work, right? That's my passion. And then after that, it's up to these representatives that when you elect them, that's one thing, folks. You have to you have to stay engaged. You have to hold them responsible. And that's another thing. Like, we have Brooklyn Park and Brooklyn Center have a majority Black council. However, when we elect them, that's not enough. We need to show up and support them, be in their ear. White people, they'll call, they'll write letters, they'll show up to City Hall. They elect you, they'll make sure that you are working for them, that you are pushing their agenda. And so it's one thing, folks, for us to elect people and put them in office, but we have to stay engaged. We have to keep in their ears. We have to be putting our agenda in front of their face oftentimes to make sure that these policies that they do eventually pass, they're being held accountable to those policies, because staff are the ones in these different institutions and systems who have to implement these policies. A lot of great policies have been passed in the state of Minnesota. I will commend Flanagan and Walz administration. They've had a lot of great policies for Black people and people of color.
Okay.
However, it comes down to holding that staff in these systems accountable to make sure that they're implementing these policy changes.
Okay.
I want to talk about some of the things that have changed when it comes to the healthcare system here in Minnesota. Like I said, we make interpreters available to people, almost every single language. If you show up, and you can do it before your appointment, make sure that the clinic has somebody there. If you need a interpreter, to have somebody. If you show up and you need an interpreter, they will try to contact somebody and see. People have even called me like, can you connect us to somebody that's crying, this thing and that thing? And I'll try and find somebody and connect them to show up at the hospital for people. And not just the hospital, in every different places, offices and spaces, they try to have an interpreter there to deal with some of these inequities and just some of these problems.
Okay. Well, thank you very much for that, folks. We'll run this maybe for the next, 20 minutes or so. It's an interesting topic, health equity in the minority communities. The panelists here are saying, it's like, for me, I'm of a different view, but hey, the panelists are saying, our socio-economic issues, places we live, lack of representation. And I would say, like, representation will keep, let's like Mel alluded to that, Titus alluded to that. I'll come back to Titus. Titus, we have a very, very important election in this country in less than 14 days, in less than 2 weeks.
12 days. 12 days.
In 12 days, we are here. You guys are here. One of the reason why we face all of the health disparities, or health equity in the minority communities, we don't have access to these things, is because we don't have representation. We have the opportunity on November 5, to elect folks like us now. Ms. B just mentioned, a lot of Black folks are supporting a candidate that doesn't look like them. That just exclude policies, right? Forget about policy. Sometimes white folks, whether you're raising their taxes or not, if you look like them, they might vote for you because, hey, at the end of the day, right, you're one of them. Why don't we do that? Why do we vote against our own interest?
Before I address that, I would like to add, quite honestly, is somewhat disappointing, right? That we as minorities do not have a fair playing field in this system, and we cannot afford to dismiss the fact that the playing field is unequal. This is why we're here speaking about the inequity.
Why is it I talk about.
We've addressed this. We've already addressed this.
No, you're talking about the playing field is unequal. You have the opportunity. There are we'll come back into representation. You have the opportunity to elect folks that look like you, that might, like all of the statistics you have, all of the data that you have coded here tonight, to maybe have an impact on those data, either to a positive impact on those data. But yet, a lot of black folks are saying, I'm not going to vote because
So
maybe
this,
this person doesn't align with my value. And then we're still blaming
so
the system.
But not enough. Not enough. It's gonna happen. Not enough are saying that to where you won't fit, like where it will show that she's not getting the black vote. The black vote is she's still getting the black vote.
But a lot of black
Is she
men,
getting
a lot of
100%?
lot of
She's
black
not.
men are a lot of black men are hesitant
If
to vote for her.
if we're getting 75% out of 100, that's good. We're not gonna get all. If we're getting 75% of 100, that's good,
Okay.
and that's what it is. She's getting enough of the black vote.
Okay. Titus, finish your thought.
and so to continue, the truth is
Hmm.
we will have to work as thrice as the other race to we're not asking for more. We're just asking for fair.
Yeah.
Um I think that's is discouraging. In as much as we are all about accountability and all about progress, being proactive, taking these various steps, like we're all saying, get involved. And this is why I can appreciate a platform like Inner Circle because awareness, I think, is something that's very lacking within our various spaces in our community. Awareness. We keep talking about this. We keep informing one another. We keep learning from one another. Let the information go out there so that people can be involved. And I think it comes to a place where we got to stop asking. We need to take. We need to take legally. We need to take. So get involved with these various, especially the local government activities. This is where your politics really affect your everyday livelihood.
Yep.
Get
Local.
involved. Your community will be impacted with these local government activities. Get
Yep.
involved. Get in the process. We need to be at the table as well. We don't have it. We don't have the same opportunity. We must fight. Unfortunately, that's the system, and we can't deny it. It's a structural thing, it's a systemic thing. We just have to continue to fight.
Okay.
Yeah.
Okay.
I
Well,
kind
guys.
of want to add to what he's saying to
Okay.
really
Go ahead.
explain the picture to people the importance of local versus national races.
Okay.
The president is one seat out of a party of how many people at the federal level, right? Locally, your governor is the one that's going to determine the taxes here in your state. Your mayor is going to determine what businesses come to your city. Your mayor helps your tax base. If you're a homeowner and you worry about your property tax being increased, it's probably due to businesses that are not coming or the businesses there are not paying their fair taxes. So these are why your local races is important. Your city council determines your water, your garbage, the businesses that come to your community, how clean your community is. That's not the president. We're only a United States around security, the army. That's the basis of our unity, to be honest. We're united
Yep.
around the president, who is a public figure. He's a figurehead for us to represent our country. And we're united around having an army to our homeland and our security. Everything else, states decide on a state by state level what their state is going to look like. The minimum wage, what wages get paid, everything is decided at the state level. That's why your local races is more important. If you don't want to vote for or Kamala, or you don't want to vote for Trump, that's fine. Go and vote. Go and vote locally.
Yes.
Okay.
Yes.
Thank you.
Absolutely.
Okay, thank you guys. Again, we are discussing health equity, and it's kind of it's like we can't discuss health equity in the minority communities, right? Without discussing, as guys say, representation, because these policies, these things that we want to happen, it's not just going to happen out of the blue. In America, everything is done by what? Policy, right? As Ms. B said, either at the local level, at a national level, at a state level. And so, if you want things to change, you gotta what? Get involved. And that's what Inner Cycle platform is about. And so we thank you all for tuning in tonight. I'll call our number 817-600-1525. This is a very important topic. To me, I like to say we black people, I would say the same thing about Hispanics. We just don't like to go to hospital. But folks, I say, yeah, that's a different thing, right? Even with all of the things given to us, we'll have all of the information. I say, oh no, I'm not going to go to hospital. The people will tell me something I don't want to hear.
I think
Now,
that's an Abraham thing. I don't even think that's a
yeah,
black or Latino thing.
I don't know
Nothing
where I
shows
don't know
that.
where he get
I
that
don't know
stuff
where you're
from.
getting your data from. Nothing shows that we
yeah,
don't like to go to
Right.
the hospital. We are not
nothing.
more unlikely.
So
We're not
why
more
are we? Why
unhealthy
why is it that these things are affecting us? Though you quoting all this data,
because when
why
the
is
people
it?
give you the study says
Uh,
what are the things that are impacting our health. The
mhm.
study does not say we don't go to the hospital or we're less likely to go to the hospital. It
So,
even tells you that when we go, these
uh-huh.
are the things that we are discriminated against.
He's
That's what
making
the
this up.
data is saying. The data is not saying we don't go. It says we go, and these things happen to us when we get there.
Status mentioned even in cases sometimes when we go, it's already late. So when do you go?
That's the awareness that we're talking about. But you know
Again,
what, Abe? You
yeah.
continue so Abe, you continue to focus on the victims. I just want to throw a little piece in there. The
Okay.
providers themselves need education. There must be workshops and training for providers all across the states
Mm-hmm.
to be able to engage, like cancel workshops that will cancel or neutralize their biases. It's there. It's all
Yeah.
over. It's not just in healthcare. It's everywhere. It's where you work. It's in education. It's in your community. It's everywhere. There must be trainings. It's just like the justice system, and that's something we could talk about another for another day.
Okay.
They
Yeah.
need training. They need to be educated. These folks need workshop that hey, the people that are coming here, these patients are patients. Whether they're yellow, brown, or black, they're patients. They all deserve equal and fair medical treatment. That's it.
Okay. Okay. Well, thank you guys. With 8 more minutes left here, we'll try to wrap this up in the next 8 minutes. But we'll get our party message from our panelists. So as I said, it's a great topic. It is a topic that they are very passionate about. The three panelists here tonight are very passionate about this topic because it is a topic that actually, and honestly, right, all joke aside, that is affecting our community. We are affected by high blood pressure. I mean, it's like Tadas mentioned earlier, how they talk, right? It's like there's so many things that is affecting us. How can we, I mean, whether it's through representation or whether it's through education, we need to get involved. So
I
as
want to
we
bring
go
I
ahead.
want to bring this to our women, black women who are paying attention and watching tonight.
Hmm.
Fibroid. We tend to suffer from fibroids the most, which do impact our pregnancy and our ability to carry, to have, to keep
Hmm.
children, and even
Mhm.
intercourse. So pay attention to that. Somebody was in my office today and was talking about that, and we were talking about the fact that we know this is data that shows that black women suffer from fibroids the most, right?
Okay.
But yet and still, the only way it gets caught is through an ultrasound.
Mm.
For me, I'm a prime example. I did not know about my fibroid until I had my first miscarriage. It was not detected until then. And so what is happening is we're having these fibroids. We don't know that they're there. There's nobody, because the only time you do an ultrasound is if you get pregnant, if you're dealing with a pregnancy. So why not put that as a preventative healthcare measure? Allow women to start getting ultrasounds, irregardless if you're pregnant or
Yeah.
not. Black women should be able to have access to ultrasound. Even ultrasound is a high cost. They don't allow you to do an ultrasound until you're like 5-6 months into your pregnancy. That's when your healthcare is going to pay for it, unfortunately, right? Unless
Okay.
there's some high risk issues, and then they'll start to do it earlier on. But a
Okay.
preventative measure I would like for us to advocate for is being able to have access to ultrasound screenings sooner rather than later to catch these fibroids before it becomes a life and death thing or detrimental to us. It messes with our reproductive system as well. We have a high rate of miscarriages because of that. So,
Okay.
ladies, go get checked.
Thank you.
Yes.
Thank you for joining out there. So Mel, I will to offer us your closing message your closing message tonight. The words out there to all the folks listening. Tonight we focus on healthcare as it relates to our communities. So, what's your parting message to our audience out there that have been listening to us?
Yeah, guys, thank you. Miss B, Tados, and Ip. This is great. I know I
Yeah.
mentioned it is complex, and those are the complexity I was talking about, right? You ask me a question now, you have your answer just at the end of it. But when you kind of look back at stats again, right? A report in 2019 by the Robert Wood Johnson Foundation says something about Hispanic 25% adults and Black 20% adults kind of delay medical, treatment, not treatment, but basically just to have health insurance due to cost. And then comparing it to the white community is just 10%. That's a huge number. And why that is, right? Low income job, not affording certain things and paying that high cost of insurance and basically avoiding other things that are important, like your cost of living, your food, your gas, and all those kind of things. These things are contributing to that. How can we get better? Is by getting involved. I know we mentioned a lot here tonight by saying, representation and representation. We can have representation if we are not involved. Like we looking at the election ongoing right now, guys. Just get involved. If you are a citizen, electable citizen of America, get involved into politics. Politics is important. It's not about just talking down on people, but making policy that will impact your life. It heavily rely on who representing you at the higher level and local level. So let's get involved into politics and get education as necessary. Get engaged into communities or group functions that look at things that will impact the life positively to kind of make sure we are not left behind. Let's keep on moving. We are in the 21st century. Let's get the information. Information is all out there. If you need help, call people that can give you the information you need to just help other people as well. I'll close with that tonight.
Thank you. Tadas, I know you're very passionate about health equity in our communities, in the minority communities. What is the message you want to leave our audience tonight?
I mean, I'll just say, everyone has really deliberated a lot tonight on everything. Well, prevention, as you know, is better than cure. We minorities, especially, we don't have I'll say good habits when it comes to our lifestyle. Maybe that's something we can improve on. The numbers might be in our favor, but I still think we could do more. We can exhibit more healthy lifestyle, so that, I mean, this is what we have to face in these parts. This is what we have to face. So why not just let's live healthily and try to prevent this, so that all of this oppression and all these different strategies and discrimination that we face, we might just be able to avoid them. I mean, other than that, as we are already in these waters, these deep waters, hey, representation, we'll keep repeating that. Let's continue to bring awareness to our community, to our surroundings. There is a dire need for mentorship. I remember in one of the episodes we kind of talked about mentors a little bit within our community, but there's a need for mentorship. Get even the younger ones connected to folks who are in various disciplines that that they can benefit from. So someone in the health field or whatever other area that younger person can benefit from.
Okay.
Trainings and workshop for these providers. It's funny that you'll even know or realize someday that there are providers, minority providers, that experience some form of discrimination. But that's a whole different topic.
Mhm.
So this thing is
Yeah.
broad. It's
Okay.
broad. But we, as we know these things, when you know better, you do better. Let's continue to take accountability, be proactive, get on the table. We cannot stress that enough. Get
Okay.
involved.
Thank you.
And thank you all for a
Okay.
wonderful discussion tonight.
Okay. Thank
Yes,
you.
this was
Mi-
great.
Miss B, what is the message you want to leave for all those that have been listening out there tonight? What is the one thing you want to leave for them?
like I said, it starts with me, right? Preventative care, right? You all make fun of me when I say I'm a vegetarian. I don't eat this. I don't eat that. You, Abraham, who want to say, "Oh, people need to be held accountable." You know, you when I tell you about my diet plan, you like to make fun of me, right? So that's where it starts. How you eat, exercise. I go to the gym. I can't wait for systems to correct themselves in order for me to be healthy, right? I have to take responsibility for my health, and then therefore I can help other people with their health. I will say my brother Mel will be running for office in Plymouth City Council in 2026. I'll be helping to manage his campaign. You guys should come and support.
Sweet.
Mm.
Yeah, start donating right now. I see that in your future, Mel. I'm putting it out there. And just, at the end of the day, I think, Inner Circle is on that path for awareness. So continue to join us. We'll continue to bring you the facts, bring you some of our personal views and our opinions, and continue to educate you. That's what we're going to be here doing. We're dedicated to doing that.
Okay, and with that, we end our show tonight.
Right.
It's been a great show. So in. We see you tomorrow. We're gonna leave social issues a little bit. All these, health.
Talk about the money.
Tomorrow is gonna
Business
be about,
and moolah.
Business and money.
and then next week we'll be back here. Tuesday we have a guest. That's gonna be discussing another important topic. And then Thursday, it's like as Miss B said, right? That's just what this platform is about. So thank you for joining tonight. We'll be here every Tuesday, Thursday, and Friday. And as we get more topics, who knows? We might increase the
Who are
day.
you hosting tomorrow, and what are y'all talking about?
Tomorrow we're gonna be talking to a lady who owns her own travel agency. So if you love to travel, tune in tomorrow. You're gonna be learning about how she, started as a travel agent.
Miss B, you better tune in.
Yeah, so it's
Woman
like,
actually bought a strip mall too. You should ask her about that.
oh, okay.
Oh,
Oh, that's good. That's good. Anyway, guys, so thank you. See you guys tomorrow, and see you all next week. Good night.
thank you
Bye,
guys.
everyone.
Bye, guys.
Thank you for tuning in.
Blessed for discussion. Thank you.